Hi guys, my name's Chia down here at Star Physio. Just here today to talk to you about ankle sprains, particularly acute ankle sprains, and how to manage them in the early setting. So just in the time that you do sprain your ankle, it is important that you assess whether or not you have a fracture or not, because this can really determine how you're treated. If, for example, you can't take too many steps after spraining your ankle, there's a big possibility that you may have actually had a small fracture or even a large fracture. So I would be not putting any more weight onto that ankle and seeking medical attention. Of course, in the early stages, you would have heard of the acronym RICE, which stands for rest, ice, compression and elevation. Now, rest is obviously very important, so if you think you've sprained your ankle, don't play on. Make sure you do rest it. Ice is also a great help in terms of pain management, and it can really help to slow down those nerve impulses and reduce that pain. Now, it can also actually help with reducing excess swelling as well by causing what we call vasoconstriction. So that's just constricting those blood vessels and stopping too much fluid just rushing in. Next up, there's compression, and this is a really helpful way, whether you use tubey grip or strapping tape, to help just cause a bit more constriction as well and stop that swelling. And it can also be great with stabilisation. And then of course there's elevation, which is just using gravity to bring that swelling away from the injured area and stop excess acute inflammation, which can cause more damage than need be. So that's RICE. Now, in the early stage, it is best to make sure that you haven't got a fracture, and to really reduce that acute inflammation. And a doctor or a physio would be a great place to start early on in the settings to make sure that you don't do any further damage. So I would try to get in contact with your physio from day one. Just make sure that you don't have any of these problems. And here at Star Physio, we do have great contact with some of the WA's best surgeons and doctors, and if need be, we can refer you on to those people to get operated on or make a cast or anything like that. So I'm Chia, and we can probably see you today at Star Physio, so give us a call and we can look after you.